Hi, I'm Ari. I'm an emergency department nurse, and I am going to tell you how to identify a possibly septic uroseptic patient. So, one of the key symptoms of urosepsis in the elderly population can actually be acute confusion. They don't have a history of dementia, and all of a sudden they're acutely delirious, they're confused. I would honestly look to see if they have a UTI. Because that could be a symptom of UTI in the elderly population. But how do you identify any sort of septic patient? Well, when a patient comes into the emergency department and they trigger our SIRS criteria, that would identify a possibly septic patient or on their way to being to septic shock. So the SIRS criteria consists of any two of the following criteria. And I'll write them up here. So 2 or more of the following criteria. An abnormal vital sign. So a body temp of 36, less than 36. So it can also be a low body temp, not just a fever, or greater than a fever of 38 degrees Celsius. A heart rate that's greater than 90 beats per minute. And that might be a little confusing because, normal is 60 to 100, but actually the SIRS criteria defines an abnormal heart rate as greater than 90. It would be also a respiratory rate greater than 20 breaths per minute. Or a EtCO2 of less than 32. And if you remember what your normal EtCO2 ranges are, sorry, I put an at EtCO2. Normal is 35 to 40 to 45. Now, what happens when your body is in sepsis and they start, or it can also be a low BP as well, less than 100 systolic. Another criteria is a white blood cell count that is elevated or below the normal range, would trigger sepsis in our system at my ER, and a lactate. So this is what happens when you're in sepsis. When you're in septic shock, your body starts going into anaerobic metabolism, and it produces a higher lactate. Studies show that if you can treat that lactate early on, then patients have better outcomes, so lactate greater than 2. Now, how do you treat the lactate? You want to get a bolus of fluid, obviously with a doctor's order, within 1 hour. And one of the most important things to do for treatment is start them on broad spectrum antibiotics, and you want to do that within 1 hour. Now, when you start them on broad spectrum antibiotics, you want to make sure that you're getting you're finding the source of the infection beforehand and what the specific type of infection is. So you really don't want to delay antibiotic treatment past that 1 hour mark, but you're going to try to get blood cultures first when you get that IV, blood cultures, as well as a urine culture, so you can identify where it's coming from. When you get a blood culture, you're getting 2 blood cultures from 2 different sites, so you can identify really what the infection is and where it's coming from. Then you would start them on broad spectrum antibiotics until those cultures come back and you can find out where the infection is coming from, what type of infection it is, and start them on more specific. And you want to do that all within the first hour, the bolus of fluids and the broad spectrum antibiotics to get them started. Because these patients that go into septic shock really can tank pretty fast. And so to review, one of the key signs of urosepsis in the elderly population, while not part of the SIRS criteria, it would trigger urosepsis in my mind, is acute confusion or delirium. And that almost, if you see a test question about an elderly patient that is acutely confused and delirious, no history of dementia, that would kind of trigger, maybe I should get a catheter straight cath into this patient, get a urine culture. A lot of times these patients who have Foley's, they can develop a UTI. So you also would be checking that as well. You never want to get a urine sample from a Foley from the bag. You always want to go on top and get it a clean catch, because there can be bacteria growing in the bag. So, okay, I added a few more points, but so to review, elderly population, acute confusion and delirium would be a sign of a trigger in your mind, not part of the SIRS criteria. But the SIRS criteria includes 2 or more of the following: a temperature less than 36 or greater than 38 degrees Celsius, a heart rate greater than 90 beats per minute, and a respiratory rate of greater than 20 breaths per minute, as well as an EtCO2 of less than 32. Normal is 35 to 45. If they start to go into septic shock, you'll see blood pressure is less than 100 over systolic. And another thing that can trigger our SIRS criteria in my facility is a white blood cell count that's elevated or below the normal range, as well as a lactate that is elevated. In terms of interventions, you want to get blood cultures, urine cultures, get an IV in the patient, start a bolus of fluid within 1 hour, as well as broad spectrum antibiotics before you start them on more specialized treatment. Okay, I hope that helps.